5, 4, 3, 2, 1, 0.
Ladies and gentlemen, I appreciate very much your generous invitation to be here tonight. You bear heavy responsibilities these days.
Welcome to Stock Legends Radio Show, seeking answers, opinions, and the inside scoop, putting you in the front seat on Wall Street.
In today's market,
This is breaking news. Where is it going next?
Ladies and gentlemen, welcome to the Stock Legends Radio Show. Please welcome today's host, myself, Quick Draw. Also today we have a company on board with us that we're very excited to tell you about. They're currently trading on the NASDAQ exchange under ticker symbol ITUS. They're a biosector stock. And we have the company's CEO on the line with us today. His name is Rob Berman. He has a lot of exciting things to share with our audience today about what's going on with their company inside of their sector. And Rob, welcome to the Stock Legends Radio Show.
Thank you for having me. Pleasure to be here.
It's our pleasure, Robin. And for our listeners today that may not be familiar with you, your past, and your company specifically, why don't you take a brief moment and tell us a little bit about your industry and your past and what brought you to where you are today?
Sure. Thanks for the opportunity. 3 years ago, my partners and I took over a publicly traded company that was traded on the OTC. And the company really was in bad times, didn't have much of a business left, and really needed a complete turnaround. And so over a 3-year period, that's exactly what we did. We recapitalized the company, updated its systems, and unencumbered its assets, and basically put the company in a position to grow significantly in the future. And part of that revamp that we did was an uplist to NASDAQ. So the way I like to describe it is we found an old rusty car, and we basically sanded it down to bare metal, cut out all the rust, repainted it, and we're looking for a new engine. And that new engine is ITUS, our cancer diagnostic subsidiary.
It's a lot of work to come in and clean up a company like that, so I have to commend you for all the progress that you've made up to this point. Now, there's a lot of different facets of your company, but we seem to be focusing primarily on ITUS. And ITUS is a non-invasive early blood screening test for the early detection of cancer or tumor-based cancers. You know, cancer is obviously a major issue that the world as a whole is facing right now. There's a race to cure cancer. There's very few people on the face of this earth whose lives have not been impacted by somebody that's had cancer. So it's a very passionate segment to be in. Why don't you tell us why you feel like this particular process may end up being the holy grail for early cancer detection and then being able to conquer cancer in the long run?
Sure. My business partner, Dr. Amit Kumar, has been involved in cancer and particularly cancer diagnostics for the last 20 years. And he's been looking for an opportunity to create a company around a technology that could really be meaningful in the diagnostic space. By meaningful, I mean a couple of things. I mean accurate, so that it detects what it's supposed to detect. And just as importantly in the diagnostic space, false positives have to be very low. A false positive is when a test would indicate that somebody has something, but that they don't have it. And so you have to be very careful when you're in the diagnostic world. The technical terms for those are specificity and sensitivity. And so he has been scouring the net and the research papers for years, came up with this concept because the technology is finally there for his vision to become a reality. And so that's why it was the right time for us to launch ITUS and the development of our screening test.
Just a source here from Wiley.com. They were saying in 2016, 1,685,000 new cancer cases, which then reflected into 595,000 cancer deaths, are projected to occur in the United States in the year 2016. This is a major issue, and it's a very sad issue. Do you personally feel that if you were able to detect cancer at the earliest stages, it would increase the probability of being able to defeat it in the long run?
Let me add a couple of statistics to what you just indicated, because they're really, really telling. According to the American Cancer Society, 1 out of every 2 men and 1 out of every 3 women will get some type of cancer in their lifetime. So, in essence, 39.6% of the general population will get some type of cancer. And so, made tremendous advances in cancer. We've learned a lot, but this whole adage of a, quote, cure is really a misnomer. Cancer, as it turns out, is 120 different diseases, and each type of cancer has various subtypes. So this adage that we're going to come up with one cure that's going to take care of all of cancer is just not scientifically correct. Since back in 1971, when President Nixon declared war on cancer, we have been obsessed as a country with curing advanced cancers. And although we've made some progress, overall the cancer mortality rates are not what they should be. Our philosophy is that too much emphasis has been placed on curing advanced cancers, and that you could make a much more positive impact on cancer mortality rates if you find the cancer early. Because what the statistics show is that if you find cancer in stage 1 or stage 2, you have between a 90 and 100% survival rate. If you find the cancer when it's stage 3 or stage 4, it's between a 20 and 30% survival rate. So we think it's been a mistake to solely focus on curing advanced cancers, and we believe that early cancer detection can save more lives and have a more positive impact on the cancer mortality rate.
That makes a lot of sense. So this more or less would become part of the process as a pre-screening or an annual checkup or something along the lines of that, to be able to identify the signature of cancer as early as possible.
That's correct. Ultimately, we see this being a blood test, just like the doctor checks your cholesterol or your liver function. We see this ultimately as a test that's used for asymptomatic patients. To give you an example of the impact that early intervention can have on a major disease, we look at heart disease. It used to be that we waited till somebody had a heart attack and then we treated them. And then starting in the 70s, we started to monitor things like cholesterol, and we started to prescribe statins. We started to open arteries using stents and promote heart-healthy diets. And what's happened is the mortality rates for heart disease have gone down 60% since the 70s, far more than the mortality rates on cancer. And so we think earlier intervention in cancer will have the same positive impact that early intervention and heart disease has had.
It also states here that this is a low cost and reimbursable type of test. Is this the kind of test that you think the health insurance companies would step in from a business perspective? I mean, you have to take a look at the overwhelming costs of cancer in general. So if a low cost test could potentially save these insurance companies, I mean, I would have to guess billions, I mean, if not trillions of dollars in the long run, would this be fully reimbursable? Is that your vision?
You're correct. We fully anticipate that our test ultimately will be reimbursable, but we're too early in the process to talk to insurance companies about that. But one of the ways that we differentiate our test to lots of other tests that are also under development is the cost. We think our test will be $200 to $300 at the most. And the way I like to talk about it is picture this. You go into your doctor's office for a routine checkup, and the doctor says to you, I have good news and I have bad news. The bad news is you have if you're a man, you've got a 50% chance of getting some type of cancer in your lifetime. And if we wait until you're symptomatic and you're showing symptoms of that cancer, well, then you've got between a 20 and 30% chance of survival. But if we find that cancer early, you've got between a 90 and 100% chance of survival. You know, we've got a simple blood test that costs $200 to $300 that can detect 80% of the cancers very early. Do you want the test? Now, ultimately, we think insurance companies will reimburse this test. But when I'm in a room full of people and I ask them that question and I say, please show me your hands of all the people that would want the test, no question, 100% of the hands go up. So even if it's not reimbursable, the test is inexpensive enough where people wouldn't mind paying for it out of their own pocket, especially if in detecting the cancer, they would have a 95% survival rate.
Absolutely. I mean, that would make perfect sense. It's a scary thing when you start getting into your later years of life. Now, let's speak directly a little bit about your collaborations. Nick, you're collaborating with some top scientists in world-renowned research centers. How do you think this has propelled your research in this area?
Well, when you're a young biotech company in today's world, you need to make a decision. You can either start your own laboratory and do your own testing, or you can partner with somebody else to do the testing. And, our philosophy has been to keep our overhead as low as possible, as long as the science is going to be done properly. And, we were fortunate enough to approach the Wistar Institute on the campus of the University of Pennsylvania. They're a world-renowned independent cancer center, and they are doing our testing and our science for us. So for us, at least at the start, if we had the opportunity to work with an institution like Wistar, and if that made it so that we didn't have to staff and equip our own laboratory in the beginning, that was the best way to go.
Having the correct team in place, it can make the difference between success and failure. Anybody in business understands that. Being, part of the group at the National Cancer Institute, also your the vice chairman of the American Cancer Society, recently came onto your board. I'm sure he brings numerous benefits to the table, as well as knowledge in the specific area. How important is having the right team in place to success, and how has the vice chairman of the American Cancer Society, these other organizations, put you in the seat to be able to bring this to fruition?
Well, let me talk about that because it's an interesting story. Dr. Arnold Baskies, who is the vice chair of the National Board of Directors of the American Cancer Society, recently joined our scientific advisory board, as you pointed out. I was at a charity event in New York that was partly sponsored by the American Cancer Society. And so I was talking to a man and his wife during the cocktail hour, and I found out that they were from my hometown and we had some things in common. And I was describing them, what we were up to with the NICSA and the direction of the company. And when we walked away, the man handed me his card, and I looked, and sure enough, it was the vice chairman of the American Cancer Society. So about a month later, I was writing an article on cancer, and I thought I would reach out to him. Perhaps maybe he could give me a quote for the article. So when I did that, and I called Dr. Baskies, I asked if it wouldn't mind giving me a quote for the article. And he said, I wouldn't mind at all, but for interests of full disclosure, I want to let you know that I own your stock. And I said, really? And he said, yeah, I really believe in what you guys are doing. I believe in the direction of your company. I think you're really onto something. I look at lots of different technologies. And I just want to let you know that based on our conversation that we had at that cancer event, I purchased your stock. So at that point, I asked Dr. Baskies to join our scientific advisory board, which he did. He's a great guy. He's a surgical oncologist, so his practice involves surgeries around cancer, particularly breast cancer. So he's helpful both on a nuts and bolts level, if you will, and he's also helpful overall in looking at the cancer landscape and where the cancer landscape is going.
We've seen a lot of recent investments from billionaires, Jeff Bezos, Bill Gates, into this sector specifically. There's a privately named company that goes by the name of Grail, probably implying the Holy Grail. There's also a public aspect of that. Why do you think the smart money is flowing into this particular field, liquid biopsy and these early cancer detections? And how do you think that's a beneficial investment to the future, maybe for an investor looking at investing in a company such as your own?
When we talk to all of the cancer experts out there, and in addition to Dr. Kumar, people that have also been involved in cancer research for all of their careers and all of their lives, if you ask them to sort of look into their crystal ball and predict where we will be cancer-wise in the future, they pretty much come to the same conclusion. They say that, number one, early cancer detection is going to be a very important piece. And then number two, they say that immunotherapies, for the most part, various types of immunotherapies will also be a key aspect in how we approach and how we cure cancer. And that at some point in the future, immunotherapies will actually replace chemotherapy. And when immunotherapies start to replace chemotherapies, that'll be sort of a watershed event in cancer because, as you know, chemotherapies kill cancer, but they also kill a lot of good cells as well. Immunotherapies, on the other hand, are able to just focus on the cancer cells. So we think it's the right time, and we see a lot of money starting to come into the space because people are now seeing writing on the wall. The writing on the wall tells us that the two hallmarks of approaching cancer in the very near future are going to be early detection and immunotherapies.
And just to clarify for the listeners that may not be familiar with the exact terminology within the sector, now a chemotherapy would obviously be radiating something into the body from an external source, and correct me if I'm wrong, but immunotherapy would be inserting a component into the immune system, which allows the immune system to then go and categorically defeat the illness from within the body rather than from the exterior. Is that correct?
So basically, we've relied on three basic treatments for cancer for the last 100 years. And those treatments include surgery, treatments include radiation, and those treatments include chemotherapy. Chemotherapy is basically drug therapy. It's basically taking drugs and putting it into your system, sometimes alone and sometimes in combination with other drugs, in order to kill the cancer cells. But the problem with chemotherapy is it kills the good cells as well, and sometimes that has a lethal impact on the patient that's receiving it. What immunotherapy does is it basically takes your immune system and uses your immune system to fight the cancer. And so there are external things that are either put into your system to do that, or modifications are made to certain cells inside your system so that they know to attack the cancer. But the difference is that in immunotherapies, it focuses only on the cancer cells and leaves the good cells alone, whereas chemotherapy, unfortunately, destroys everything. Immunotherapies are still also in their experimental phases. They still have to go through FDA approvals, and the price has to come down because a lot of these immunotherapy treatments right now are hundreds of thousands of dollars. And we have seen over time that there's no sense coming out with a treatment if people can't afford it. And so we think that over time and in the next coming years, the price of immunotherapies will come down, and so they will be more affordable and ultimately, like I said previously, will replace chemotherapies. But one thing I want to add, our technology, early cancer detection, is actually complementary to immunotherapies. And what I mean by that is most of the time immunotherapies are tried once people have advanced cancers. And in many cases, they help 30, 40, 50% of the patients. Well, imagine if you take those same therapies and use them on the patients before the cancer is advanced. We think that the success rates will be even higher. So we think that early cancer detection is in essence a treatment in and of itself, because in many cases, if you find the tumors that are small enough, you could simply cut them out with surgery and you wouldn't need follow-on treatment. Also, we think it's complementary to other treatments like chemotherapy and ultimately immunotherapies, and will make those treatments more effective.
It seems as if this early detection is somewhat of a necessary stepping stone for the immunotherapy companies. Have you ever thought of any type of cross-synergistic acquisitions within a particular segment like that?
Down the road, something like that is a possibility. But right now, everybody sort of has their own blinders on, working on trying to make their own technologies work and bring their own technologies to market. So it's a little bit too early to contemplate something like that. But, we're always looking for opportunities and always have our minds open.
I completely understand that. It's such an innovative sector that everybody's kind of holding their cards close to their chest. And we've seen this many times. We saw it with technology advancements when computers were first coming to market and things of that nature. So once it starts to open up, obviously that will change down the road. Let's talk a little bit specifically about this approval process and what that process is like getting something like this to market, as far as your timelines are concerned.
Sure. There's basically two ways to launch a diagnostic test. One way is what's called CLIA, and CLIA stands for the Clinical Laboratory Improvement Act. And basically, you could launch your test by having a lab certified to run your test. And that's sort of the CLIA route. The other way is to take it through the FDA. Now, if we decide to launch our test via the CLIA route, our test could be on the market within a year. FDA is more like 2 to 3 years, depending on how the process goes. We haven't made a final determination yet of which way we are going to launch our test. We're basically waiting for our next data set to come out, the next results of our experiments, which we expect somewhere around the end of Q2 or the beginning of Q3 of this year. And once we have that data and evaluate that data, then we'll be able to make a determination of whether to go the CLIA route or whether to go the FDA route.
As far as this early detection screening process is concerned, are there any patents that you're planning on filing? And tell us what those look like.
Well, absolutely. I can't tell you what they look like because we're about to file them.
Yeah, maybe I should have rephrased that.
Look, patents are an important part of any technology. We have a lot of experience in patents, having run patent licensing companies in the past. And so we are in the process of putting our patent applications together, and we expect to file them within the next 4 to 8 weeks.
For those of you that don't know, the patent process is also a very tricky process. There's lots of tripwires. The verbiage is extremely important, especially on a technology that is as important and competitive as this particular segment. So those patents will be extremely interesting to see, in the verbiage. Blocking patent can make a company overnight. So I'm very excited to see those patents start coming around. This is an amazing technology. It's so needed. I mean, you have to be very passionate about this.
Look, we're talking about people's lives here, and we're talking about helping to save people's lives from the ravages of cancer. And so we are certainly incentivized to make this company a success and to make money for our shareholders. But frankly, this is beyond that. This is a mission for us. Cancer has affected, everybody knows somebody that has been affected or that's had cancer, whether it's a mother, a sister, a brother, a parent. Cancer is a global epidemic. 8 million people worldwide are going to die from cancer this year. 8 million people. And so we are certainly advocates for our shareholders and for increasing stock value and making money, but we are also advocates for cancer patients on a worldwide basis because our technology can really help people and can really save lives. And we are on a mission to bring that technology to market.
It's not often that you have the opportunity as an investor to get in on the ground level, especially of a NASDAQ company. You've done a phenomenal job as a CEO, as the leader of this company up to this point. For those of you who don't know, it's not an easy process to bring a biotech company like this onto the NASDAQ. There's a lot of room for the price to appreciate given the circumstances, especially at this level of the game. It's a very exciting opportunity. It's a ground level opportunity to really dig into the details, the data, the industry. For bio-savvy investors, this is without a doubt a company that you would have to look at. I mean, the data alone gives you an idea at where this particular segment of the sector is going. It has to be an exciting time for you and the company right now.
The last 3 years show that as a management team, we can execute. I mean, in essence, we took a company, excuse the pun, that had its own fatal cancer, and we're able to cure it and turn it around. And that shows that we're capable and that we can execute. And now we have this new engine, Anixa, which is going to propel the company forward. And look, as I said, 39.6% of the general public is going to get some type of cancer in their lifetime. So the market is huge. And I might add that there's plenty of room in the market for multiple technologies. So we're not saying that we're going to be the only cancer screening test. We think that we have some very distinct competitive advantages over the other tests that are currently in development. But this is a very, very large market, and there'll be room for multiple companies.
It's been very exciting to watch you as a CEO. Now, Rob, for investors that might be watching today, maybe they're larger scale private investors, maybe they're market investors, all different forms of investors. What's the best way to contact you directly if they have questions, or is there a contact form or email that you utilize for that? Maybe they want more information about the product in particular. What would your advice be for people that fit that particular category?
I would say to visit our website often. We are a very transparent company. We are constantly in touch with our shareholders, and the best way to see what's going on is to visit www.ituscorp.com, where you can click on Anixa and see exactly where we are, what our latest announcements are, and what's going on with the company. Of course, if anybody wants to reach out personally, there's the ability to do that on the website, and we get back to all questions within 24 hours. At least that's our goal.
It's a great company with full transparency that's searching avenues to connect with their investment community, that's done such a good job going from ground level to where you are today. And it's still at such an early stage. This is a very exciting time for your company and for your investors. Is there anything that you'd like to say to maybe your long-term investors that have been on board with you for quite a while at this point in time, listening to the interview today?
Absolutely. We appreciate your continued support. We have positioned the company to be in the right place at the right time. And that is an important element in any company's success. Anybody that tells you that luck and being in the right place at the right time is not a factor is really not telling you the truth. And so we're in the right place at the right time. Our preliminary data looks very good. We're anxiously awaiting the results from our expanded study. And stay tuned, because there's more great things ahead.
That's very exciting. Now, for the investors listening today, one more time, this is the NASDAQ-traded company under ticker ITUS. Robert, it's been our pleasure having you on the Stock Legends radio show today.
Thanks very much, Justin. And I just wanted to point out, previously I alluded to the competitive advantages of our technology versus other technologies that are being developed. Would you mind if I just list those off to you?
No, I would love it. Go right ahead.
So first of all, we already mentioned price. Several of the early screening tests that are being developed are thousands of dollars. And as you pointed out earlier, there's problems with both affordability for people paying it for themselves and with insurance reimbursability. And we expect our tests to be in the $200 to $300 range. So that's competitive advantage number one. Competitive advantage number two is that it is very unusual to find a set of biomarkers that can be used for multiple types of cancer. And we believe that our particular biomarkers can be used for any cancer that is affiliated with a tumor, any solid tumor-based cancer. That's about 80% of the cancers. So that's our second competitive advantage. Third, again, so far, the specificity, meaning the accuracy, and the sensitivity, meaning the false positives on our technology, have been, frankly, off the charts. I mean, thus far, with the small group of patients that we've tested, we've been 100% on the accuracy side and 0% on the false positive side. Now, we don't expect those numbers to stay at 100 and 0, but we do expect them to be very, very favorable. And so we think that with those three competitive advantages, we will be able to compete against any screening technology that's currently under development.
Those are amazing statistics. This is a very exciting process that you guys have put together here. I can't wait to find out. Now, will you publicize the results of the study that you're waiting to come out here shortly?
We will. We'll make those results available and possibly publish them in a scientific journal as well. And so, yes, we will absolutely make the markets, our shareholders, and make that information available.
time is of the essence. You're very passionate about it, talking about millions of people that are affected by this. It's great to find a niche that you feel good about. I mean, you have to feel good going to work every day. It's a huge confidence builder.
The stories that I hear from people when they ask what you do, if I'm traveling on an airplane or whatever, and talking to potential investors, the stories that they tell you about their loved ones and people that have been impacted by cancer are truly heart-wrenching. And I've always been passionate about what I do, but hearing those stories and seeing firsthand the ravages of cancer have made me even more passionate. I mean, as I said earlier, this has become sort of a mission for us, and we're just not going to let anything get in our way, and we are going to make this a success because it can really, really change millions of lives. And it's that important, and we are laser focused on making it happen.
You couldn't have said it any better, Robert. Again, thank you so much for coming on the radio show today. I look forward to watching. I've got my ear to the street. And again, for the investors today, publicly traded on the NASDAQ under ticker symbol ITUS. Robert, thank you so much for your time.
Thank you for having me.